Okay, we are back. Senate Health and Welfare, March 10th, and we're now taking up S 239, which is relates to the supplemental health insurance, Medicare supplemental health insurance policy. So, Jen, we have a draft before us that we worked on a little bit with our proposed amendment.
Right. So Jennifer Carvey, Office of Legislative Counsel. You do have a new draft. I think it should be posted on the web page. It is draft 1.1. It's a strike all amendment, and I have the changes shown in yellow, so hopefully this will be easier to see.
Okay, why don't we just go through the draft? So we
see people busily pulling it up, so I thought I'd give them a moment.
Oh, I'm sorry.
To find it.
I pulled it up before we broke, so it's all right.
Okay, so section 1 of the bill is largely unchanged. It continues to have the guaranteed acceptance period during the 6 months following the person's initial, after their 65th birthday, during that initial Senate period, and during an open enrollment period. We had talked about, but either we decided not to, or I missed it now that I'm looking at it, about having the enrollment coincide with Medicare Part C, the Medicare Advantage. Did you want that and I missed it, or did we decide not to do that?
I'm gonna yield to Senator Cummings on this and ask her if this is something her committee is interested in working on.
I have my committees. So which you wanted, the Medicare Advantage?
There was, yes, I think after initial testimony, I think maybe it was, or after the initial bill, I think Mike Fisher may have actually recommended, and he's logged back in, changing that open enrollment period to coincide with Medicare Advantage rather than Medicare Part D. And that change is not reflected there, and I don't recall if the committee had discussed
Well, we're
it.
going to be looking at it, so.
Right, I mean, this is.
I've already invited Mike down.
This is an easy time to make the change while you're making changes. So if you think you want to do that, maybe we just put it in here and then you don't have to.
Well, my committee may decide to do something different, so I don't know.
So do you want me to leave in the Part
That it makes
D?
that much difference.
Wait, what? We're looking at paragraph D, Jen?
No, it's Medicare Part D, page 1, line 16. It's talking about
Okay.
open guaranteed acceptance during open enrollment, and that would coincide with the federal open enrollment period, either for Medicare Part D, which is what it was in the bill as introduced, or Medicare Advantage plans, which is the healthcare advocate's recommendation when he came in and provided testimony, but you had not discussed it.
The real problem seems to be the Advantage plans.
Is Part D the sorry,
Can we ban Joe Namath and Jimmy Walker?
Yeah.
Feisty old lady.
drugs plan. That's what I thought. I think
So you want to put in the change, make a change to Advantage plans? Your committee's going to look at it anyway, but if we,
That's whatever.
Okay,
Yeah,
we'll
that makes
change it here to Medicare Advantage.
I'm just thinking if we don't make any changes, it won't. We won't have to wait for another.
yeah.
Well, you're gonna have to wait. I mean, you can't vote it out. You can vote it out with these changes in it. You won't have to wait for the clean pass.
Okay.
So then the new language is on page 2, a new. So, because this is adding a subsection D, right? So this is a new subsection E for the existing statutory section that would direct the Department of Financial Regulation to collaborate with health insurers, advocates for older Vermonters, and for other Medicare eligible adults, recognizing that there are some who are not older Vermonters, and the Office of the Healthcare Advocate to educate the public about the benefits and limitations of Medicare supplemental health insurance policies and Medicare Advantage plans, including information to help the public understand issues relating to coverage, costs, and provider networks.
Can you remind me, did we have DFR in on this bill? I can't remember what they said now.
did Emily,
Emily Brown talked
Yeah.
about
Okay,
what they,
okay.
yes, she talked
Okay.
about what they can and cannot regulate.
Right.
Right, now I remember, okay,
But education seems allowable.
okay.
All right, section 2 then is, we add some provisions to the report of the stakeholder group and their report. So this still has DFR convening a group of interested stakeholders. There was a specific request to include representatives of the COVE, the Community of Vermont Elders, the Area Agencies on Aging, and the Office of the Healthcare Advocate to consider issues relating to the availability of, enrollment in, and use of supplemental coverage by individuals enrolled in Medicare or a Medicare Advantage plan. A majority of the stakeholders shall not have a financial stake in any Medicare supplemental coverage or Medicare Advantage product. It's adding Medicare Advantage in here, and directs the stakeholder group to examine not just the options available to older Vermonters through Medicare Supplement and Medicare Advantage, but also Vermonters under 65 years of age with end-stage renal disease. That was the request from the advocate that you heard from DC with the dialysis group. So the options available to older Vermonters and Vermonters under 65 years of age with end-stage renal disease through Medicare Supplement and Medicare Advantage plans, the affordability of these options, and the extent to which the state may regulate or otherwise affect the options offered to Medicare beneficiaries in Vermont, including the marketing, and this would add, and advertising, which is marketing, but also more specifically names it of these products, because that seemed to be a particular concern. Yeah.
The end-stage renal disease, I remember that testimony. Are there other diseases or groups of people who qualify for Medicare earlier than 65?
There are, yes, people there are under 65 with disabilities.
So
like
should we
significant
make it
disabilities.
broader to just say, what is end-stage renal disease a disability?
It is a specific category of Medicare eligibility that is just about end-stage renal disease.
Yeah, I know. I'm just wondering if there are others that we should try to include in here.
So I would say if you wanted to expand this to discuss the Medicare eligible Vermonters under age 65 with disabilities, I think that's fine. I would not assume end-stage renal disease
Okay.
fits in that category.
That's what I wanted to know. Should we include all disabilities or?
I guess I'm looking at Mike to see if that seems to be if they experience the same issue of concerns, or if those individuals are more likely dually eligible for Medicare and Medicaid, and so not in the supplemental coverage market.
Mike Fisher, healthcare advocate. My recollection of the testimony included that end-stage renal disease was a very specific category of its own that was
Right.
warranting focus. I think the bill.
I think the question here, Mike, is do we, in this, what the stakeholder group examines, should it be the options available to older Vermonters under 65 with end-stage renal disease, and Vermonters under age 65 who are Medicare eligible?
Yes.
Okay.
I think so.
Does that make sense?
Yeah, that makes
Then it captures everybody,
Yeah,
but still
they're
calls out
mentioned
end-stage
earlier.
renal disease.
Madam Chair, if I could just say a sentence or two more.
Please.
I think that the language before you accomplishes this, but I just feel the need to say it out loud. The crisis, I think, the thing I want the working group to focus on is the number of Vermonters who are on Medicare with no secondary coverage. That's a population of people we know who are very exposed or underinsured, if you will. And so yes, it is about Medicare supplemental. Yes, it is about Part C. It's also asking the question, what are the policy options for us as a state to address this population?
Do we need to say that more explicitly, Mike?
I guess that's kind of why I'm saying it out loud. I'm not sure. I think asking the question of what's the right thing to do with supplemental plans and Part C does get at the question of this population, but I would like the question to be a touch broader.
Mm-hmm.
I don't know if there's any state out there who's doing something interesting for this population, or if there's any other policy options out there.
So
Where would you put, I think what you're saying is probably important. Where would you add a sentence or phrase to be more inclusive?
It sounds like it might be somewhere in this list, and maybe a number 4 to say that the stakeholder group would examine the reasons why Medicare beneficiaries who don't have supplemental coverage have not gotten that coverage. Is that really the question you're?
I would say who don't have secondary coverage.
Secondary coverage.
Either.
Yeah, no, that's a better phrase.
That would be number 4 under that list. That would be good.
So to examine either the obstacles to
And-
secondary coverage or.
And policy options available to address this, this need.
Okay. Thank you. That's helpful.
Great. All right, and then on or so did I get through the list? No. So then we had then the in the list of what they're going to examine. So I made some additions here. Number 1 will be the options available to older Vermonters under 65 years of age with end-stage renal disease, and Vermonters under 65 years of age with Medicare eligible disabilities through Medicare supplemental and Medicare Advantage plans, and then that would continue on as written. Number 2 is the effects of annual or continuous open enrollment periods for Medicare supplemental coverage available in other states, including whether they led to adverse selection or higher rate increases or both, and the extent to which an open enrollment change for Medicare supplemental coverage would be likely to increase access to affordable coverage for eligible individuals and to reduce medical debt. Whether Vermonters are receiving accurate information about Medicare supplemental coverage, and we've added and Medicare Advantage plan options, and sufficient assistance with selecting products that are best in their best interests, and if not, how best to remedy the situation. And then we will add a number 4, something to the effect of reasons why Medicare beneficiaries who do not have secondary coverage are not taking advantage of that opportunity, and what policy options may exist to address that. Then on the page 4, we would have the report back from DFR with its findings and recommendations regarding Medicare supplemental coverage and Medicare Advantage plans, including any recommendations for changes to Vermont law, to this committee, the Finance Committee, and House Health Care. And for effective dates, section 1, which is the creating the guaranteed issue during open enrollment, would take effect on July 1st, 2023. So that would be after you get the report back in January, in case you want to make any changes to that before it takes effect. And section 2 in the report would take effect on passage. So that's just one other thing to note there on that effective date, that you would get the report back. I think that was one of the requests from at least one of the witnesses, is to not to do it and then study it, but study it, report back, and then and this would have it starting without you doing anything to change it, but would allow next year's legislature to make changes or move out the date if it didn't make sense.
Okay, comments, questions? It looks good. I think, is there a way that we can get a clean copy?
Well, I still need to do some drafting. Now that you've made more changes, you may want to actually see it before.
Yeah, we would want to do it. Here's what I'm going to ask. Here's what I'm going to suggest. We had talked, Jen, before you came in about the bill, and that it will go to finance. So to sort of move it more efficiently from here to there. Yes, Senator Cummings?
Well, that's a question that's come into my mind. If you just relinquish the bill to finance, do I get the extra week, or am I going to have to get this bill out tomorrow?
Oh, that's a good point.
I think you have to, because I think,
If it gets referred.
oh, it's getting referred to you, but not because it affects the revenues of the state, but because it's an insurance bill.
Well, it should come to me as
It
an
should come to you as
insurance
an insurance
bill.
bill, but I don't know if, but the money, I think the money committees generally have
Do
the
you want me to
extra.
run up and ask Bloomer?
I guess I'm sure, but I'm not sure why.
Yeah.
Why.
Send him a note. Yeah, okay, go ahead,
It's more
Rita.
efficient to run. I'll be right back. And we can do this now, because we're in the building.
That's right. We
Okay,
find out if
so
Bill
this-
sent up last night and registered.
I mean, I can potentially work up the changes.
If you work up the changes, that the only question is, do we vote and send it out and it goes to finance, or do we just have our committee relieved of the bill and committed to finance? So that's where we are. That's the question we were asking. And if
That extra week.
Right, I think
Yeah.
you're probably better off if it gets referred to.
I would think you'd still get the extra week.
But
Even if
Bloomer
it's just
is,
referred.
I know.
Exactly, no, I think it makes sense to check.
he marches to his own drum.
We don't want to have a glitch.
No, because this is important and it needs,
It needs to be done. There's no
But
question.
if we vote it out, it'll still go to finance.
that's what we're not sure of. Bloomer
Well-
makes those calls.
We-
It should.
Which would give it an extra week, but we don't know whether or not it would have the extra week. if we-
Well, we can ask, we can suggest, and Senator Cummings, my suggestion is that you comment to Secretary Bloomer that the bill should go to your committee.
We'll definitely do that.
Yeah,
And we will,
If we can just send it there now without voting on it, it would.
yeah, that would really save a lot of time.
save some time.
And, yeah, and give you the time.
And would give me the time so I can take it up first thing on Tuesday. I've got the corporate income tax and military pensions to do.
Madam Chair, Mike Fisher here again.
Yes,
Oh, yeah.
I think I just want to call the attention to the effective date of section 1 and say that the HCA will live with that. That is not our preference, that we believe the annual open enrollment is a reasonable balance point between access and concern for the market. But I've heard, but it's hard for me to argue against DFR's position that we should study something before we change it. But I just wanted to say out loud that
okay.
so I'm accepting of the language that's here, but I'm going to continue to advocate for the annual.
That's just fine, Mike, because it will go to finance, and that's a good conversation to have in finance. I don't have any, we don't have a strong feeling about this. We just really want to make sure that people understand what they're signing on to, and that people who can get access in a cost-effective way do get it. So no, I encourage you to continue the good work that you've been doing in finance. Not a problem. And so while Jen is finishing it up and we're waiting for Ruth to run,
Can I ask a question?
yeah.
What is this building and why has it gotten center stage in our committee table?
Yes.
I found it in the box in our committee room, and we're going to decide what it is. I think it might be the
It's something hospital.
No,
Not
it's
the Vermont-
National Taiwan University Hospital.
oh, it's the National Taiwan
Isn't
University.
the building at the Big E?
So Senator Cummings, you should be familiar with that building.
We didn't go to that building. We did all commercial trade.
Is this the big?
Oh,
No.
It's the
okay. So I want to bring us back. Here's Senator Hardy is back with the
Okay,
news.
this is what the Senate Secretary has requested or suggested, is that we pass the bill today out of this committee. Then I stand up on the floor and he's gonna write me a script saying that we want to refer it to finance under Rule 31. If
Oh,
I
good.
say it, then he
And Rule 31
has been invoked.
is that.
Everybody will agree to it, and then it will go to finance and you'll get the extra
Okay,
time.
way to
So,
go.
so Senator Hardy, can all of that happen today?
Yes, he said if we get him the bill by 12:45, it can happen, so sorry, Jen.
Oh, I'm working on it right now.
And then and that since you're not here, I'm the.
You'll do it. No,
and
that's great.
that he would prefer that I also be the reporter of the bill. So I was like, okay, is that all right? I don't know.
No, no, we're not going that far because I think this is Senator Hooker's bill and I want to give her that.
Okay,
Yeah,
I mean,
so,
I can tell him that. That's what he just asked me if I could also do that. And I was like,
no.
sure.
Yeah, sure you could. You do a great job, but no question about it, but I
That's
think.
fine. I have no tie
And
to, I don't
I just
care.
wonder what the secretary's purpose is in suggesting.
Nice.
Yeah,
Yeah,
because you're in finance, I suppose, but you may
Yeah.
report it out of
He just
finance.
doesn't-
Yeah.
He just, yeah.
it's fine. I'm sure it's fine. I just
Yep.
wanted to.
Yeah, no, I think it's
What
fine.
he
He
said.
doesn't want the
Thank- so-
reporter standing up and saying, I don't know anything about this.
Senator Hardy, thank you for doing that.
Yes, that's good.
That's why I want to sit near the door.
Did you find out that if our bills we sent up last night?
He did get, I think so.
Can I ask,
They're on notice today, aren't they?
Let's see.
Because that means.
this
they're
is, I don't like being in the screen.
They're on notice today. I've got to go home early and.
I don't think they are.
All right, so here's my suggestion, committee. Are you there? So while Jen is finishing that up, can we scoot over to S204?
That's for Bill too, though.
So I am,
No,
I just sent this for editing so they
Oh,
can edit
good.
it while we look at it, but I can send it to Aaron if you want to see it.
good idea.
Or, you know,
Okay, let's do that right now.
They're not.
And we'll hold off here on 204. Let's go to 204 and then we'll come back to this one. Jen,
Yeah.
let's do that.
Oh, that's
They're
their
not on notice. Yeah, just that cannabis bill is.
All right, so
That's
204.
actually spent half the morning trying to straighten out amendments to that, so.
All right, 204, Senator, we're on 204. And we're going to have Jen show us the new language that is highlighted.
239, right? We're still on 239.
Oh, do we have it posted yet? That's all.
Oh, he's working on it.
Okay, well, then we'll go to 239. This is ruled by committee. I'm fine. Okay,
So I have sent it for, whoops, I did not change the version number, but I changed the date and time. So it should say 1.2, but mine says, yeah, it should have said 1.2, but we're not gonna, I changed it on here, so the official version will be 1.2.
Jen's in charge now, Jenny.
I got it. I got that.
Sit in your chair.
I finally had to put it down because my. feet
It's a
weren't-
losing game.
Okay.
Control is tenuous at best.
So we'll just refresh when Aaron tells us. Which do you like better? Do you like the white masks or the black masks?
Well, this is just one of those kind of surgical masks. I like those better because you don't suck it in every time you breathe.
Yeah.
That's true.
I didn't have a black one to go with
Yeah.
my outfit.
I wish I had different colored ones, but I'm too cheap. I just use the free ones they provide us.
And I'm actually I'm gonna have you swap it out for 1. Same thing, but 1.2, but we can still be talking about it. Swap it out.
Hi.
Hello.
And Nolan is here.
I am.
I love it. No.
There's anarchy in the committee today, so,
I figured if I come in here, I can bring order.
yes, exactly.
Not gonna happen. Jen's in charge.
All right, should be up.
Okay, refresh your page.
It should be up. It says 1.1 on it. I just sent Aaron the same thing that just says 1.2, so he'll swap it out online, but we can still look at this. That's the only thing.
But the date is 3/10 on the one.
The date is 3/10 and the time is 11:31.
Okay, let's do it.
All right, so it should now be clean version. I will just point you to the changes. So in section 1 on line 16, we have this coinciding with the federal open enrollment period for Medicare Advantage plans rather than Part B. On page 2, I've just taken out all of the bold and highlighting. No other changes. On page 3, B1, starting on line 5, the stakeholder group is examining the options available to older Vermonters under 65 years of age with end-stage renal disease, and Vermonters under 65 years of age whose disabilities make them eligible for Medicare through Medicare Supplement and Medicare Advantage plans. I might put a comma here, between Medicare and through Medicare Supplement, because I think it's confusing otherwise, and the affordability, etc. And then numbers 2 and 3 are the same, but 4 is new, and there's an and, it's not an and, there is an and. It says the reasons that some Medicare beneficiaries do not have secondary coverage and the policy options available to increase their access. Does that work? Great.
Yes.
And then other than that, just taking out the bold and highlighting and struck through it. Such.
Okay. And we have heard from the healthcare advocate that he will be advocating further in the finance committee, among others, so it's helpful.
The Blue Cross has already told me they will be advocating.
All right.
It'll
I'm
be
sure.
fun.
You're gonna. All right. Is there any further discussion on this bill?
And the only other thing I'll note is that I sent it for editing, so I would like to be able to make any minor changes that they send.
That's fine. And this would be draft 1.2 or 1.3?
Let's call it 1.3 once the
Okay, once the editing is done?
is done.
And when it's, okay,
We may still literally be here. I mean, you know, they're editing it right now. So if you want to go to 204 and then come back and vote on this,
Let's do it. Let's go to 204 and come back just in case.
sorry.
No problem.
Clerk.
hold that pen.
Hold that thought.
Very official. This is how I do it.
There is a form, now that we're here.
Yeah, there is
There's a form, yeah.
Yeah, Aaron should be able to find through the form.
If you want one, I can make one.
Okay, so,
They have forms.
okay, so Jennifer Carby, can we go through 204?
Yes.
All right.
Donald has a whole.
We have draft 1.2 on our webpage.
Draft 1.2, and this is what we looked at the other day. So I've not made any additional changes to what we looked at the other day. The whole licensure part is the same as we have looked at in the past. Just to remind you what's in here, section 2 has not changed. That's the health insurance coverage, including birth center services. Sections 3 and 4 are on certificate of need and requiring a certificate of need, but not starting that requirement until July 1, 2023, because in section 5, you have a report on the needs assessment from the Green Mountain Care Board. So section 5 on page 8 directs the Green Mountain Care Board as part of its HRAP duties and in consultation with the Health Department's Maternal and Child Health Division and the Blueprints Women's Health Initiative, conduct an assessment of the need in the state for the obstetric and midwifery services offered by freestanding birth centers, including evaluating the need for the services in particular regions of the state and for certain populations of Vermont residents. And by April 1st, you would get a report from the board with its findings and recommendations regarding the need for the services of freestanding birth centers in Vermont, along with a recommendation for whether persons seeking to establish a birth center should be required to obtain a certificate of need. Section 6 directs the Agency of Human Services to seek approval from CMS to allow Vermont Medicaid to cover services offered by a licensed birth center and to allow separate reimbursement for the birth center services and facility services. And we have the new effective dates with the licensure piece taking effect and the insurance coverage on January 1st, 2024. the CON provisions taking effect on July 1st, 2023. The Green Mountain Care Board needs assessment taking effect on passage. And we can change the, Deva responded to say that we can change, and actually we'll just put in section 6, the request for federal approval. We just need the coverage to start by January 1st, 2024, when everything else does.
Okay. Comments, questions? I know that there's been a flurry of activity around the Green Mountain Care Board and others evaluating the CON, but I think it's probably the right thing to do, and it will help to alleviate problems going forward. So discussion, questions for Jen or others? Go ahead, Ruth, you worked hard on this.
Yeah, I just wanted to mention, I know that we all gotten emails saying that this study has already been done, but the study that people are referring to was a study about freestanding healthcare facilities more broadly that included surgical centers and birth centers. And the conclusion in that report was actually to do what we are doing, which was to elucidate the licensure pathway. And that is what is in H204 or S204 among other things, is to make it clear. But first, for doing an actual needs assessment, which is not what the previous study was. The previous study was much more focused on our birth centers staffed, how are they staffed, are they safe, what do they do? And it concluded they are extremely safe, they have very good outcomes, this is what they are, this is what they do. So those questions were answered, but there was not a sort of a statewide assessment of the need for additional obstetric services, including and especially the services of freestanding birth centers, which are different than services provided in hospitals. But given the work that we're doing about sort of looking at the big picture, it seems appropriate to have a more broader needs assessment so that it is really part of our work on the full picture of the healthcare landscape. So,
All right.
I just wanted to say that.
Good. No, thank you.
Emails.
Thank you for that. I think that's really important for those listening in to understand, and that's very important. Okay, so at this point, I would entertain a motion on this bill.
I would move passage of
1.3.
I'm gonna make it 1.3 because I'm cleaning up
204.
204, yes.
S204 version 1.3
As amended.
I'm cleaning it up and
as
I'm
amended.
making section
Strike all. Strike
6
all amendment.
effective on July 3rd for Medicaid coverage beginning on January 1st, 2024. So take effect January 1st, 2023 for Medicaid coverage beginning on January 1st, 2024, so that it's consistent with the rest of the provisions.
And I think we have to move to amend, don't we?
Oh, do we? I don't know.
Yeah, you move to amend the bill and then approve the bill as amended.
Yep. Yep.
So I moved to amend the bill as
That's what
recommended.
my clerk makes me do.
I know he does the double voting. I don't think any of my other committees have ever done that.
You can just say move the bill as amended in
Okay.
draft 1.3.
Okay, well, let's do that.
Do that.
Further discussion? We have a motion on the floor, on the table, in the virtual world. As any further discussion? Okay. Senator Clerk, please call the roll.
Okay, this is for S204, draft 1.3. Starting with myself, yes. Senator Cummings,
Yes.
Senator Hooker,
Yes.
Senator Hardy,
Yes.
and Senator Lyons.
Yes,
Vote of 5-0-0.
excellent. This is good. I forgot whose bill was this? Is this my bill or Cheryl's bill or?
I think you were the first named sponsor, but several members of the committee were co-sponsors.
Okay, Cheryl, you're doing the other one too. You've got two bills right now. Ruth, you've got like a couple or three bills.
Yeah.
Is there anyone else who would like to report the bill? I'm looking both at Senator Cummings and Senator Terenzini. Before the,
Fair.
huh?
I prefer not to do this one, Senator Lyon.
Okay, so are you interested at all, Senator Cummings?
Not given what I've got on my plate from my other committee.
Okay,
I'll do it because we really want one in Rutland.
Yeah.
do Senator Hooker, you want to do that?
I would if, unless Senator.
No, that's good. I'll tell you what, if it's not you, it's me, and I'm very happy to have you do it. I think it would be great.
So I don't know who you're looking at. Yeah.
I'm looking at Senator Hooker.
It's hard to tell on the screen.
That gives you three bills that, you know, there's no appropriation in this one as far as we can tell, so it should be going pretty quickly, and that's a good thing.
With a little luck tomorrow, I'd like to do the ALS bill if it passed.
Oh, yes, I've got you, I have you targeted for that one. That's good.
She is not here. She is remote right now. It's great.
Oh, good. Okay, Jen, how are we on 239?
We are good. I got back to the editors. They didn't have any changes, but they had a question, which is actually a good one for me. It's just an inconsistent term, and I have changed it. So in the new language in section 1, in the new language in section 1, and this is not a substantive change, but on page 2 in subsection E, where DFR is collaborating with others to educate the public, I had described them as Medicare supplemental health insurance policies, but everywhere else we just talked about Medicare supplemental insurance policies. And questioned whether there's a reason that said health and if it needed to stay there, and no, it should come out and be consistent with everything else. So it'll just say Medicare supplemental insurance policies.
Okay, we're good with that.
This is 1.3.
Yes, 1.3 as well.
Is there a motion on the table? This is, Senator Hooker, you're getting two bills at once. Go ahead.
I move that we accept the committee's decision on, or I move that we vote on S239. Draft 1.3.
Okay, as amended?
As amended.
Okay. Okay, discussion? All right, Senator Clerk Terenzini, please call the roll.
All right, I'll call the roll for S239 version 1.3, draft 1.3. Starting with myself, yes. Senator Cummings,
Yes.
Senator Hooker,
Yes.
Senator Hardy,
Yes.
and Senator Lyons.
Yes, thank you. Very good.
Okay, 5-0-0.
Okay, and Senator Hooker, you're on the hook for this.
Okay, thank you.
All right. So this is terrific. I think we've accomplished what we wanted to this morning, I think, except it would be great to have some clean language on 285 for us ASAP, and I know we're waiting on others for that. So Jen, we'll just stay connected and we'll get language out as quickly as we can so that everyone can be ready for our discussion tomorrow. And I will be there tomorrow morning at 8:30. So there won't be any more insurrection going on, but we'll see how it goes.
No, Jen was in charge.
That's what I mean,
Voted
yeah.
down 2 bills.
He's gonna be in charge tomorrow. Yeah, so listen, I can't thank you enough for the real this has been good work today, and it's been good work all session, and I greatly appreciate everything you've done on our bills. We've done some good work and look forward to finishing whatever we can do tomorrow on our other two bills. I don't think we have anything outstanding after that. Okay. Take a few minutes and Aaron,
Yeah.
oh, why don't we go off YouTube?
Okay.